This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everybody, and thank you for joining us for our HealthyU webinar series. Today's topic is women's heart health. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes. Your questions will remain anonymous. Today's presenter is Dr. Sharma. He is a highly accomplished cardiologist with extensive training and board certifications. He completed fellowships in cardiovascular disease and advanced heart failure and transplant, and holds board certifications in internal medicine, cardiovascular diseases, cardiovascular computed tomography, and nuclear cardiology. Dr. Sharma grew up in Floral Park, Nassau, and pursued his undergraduate studies at Hunter College, New York. He earned his medical degree from Ross University School of Medicine and completed his residency at Stony Brook Medicine at Mather Hospital. He further specialized through a fellowship at the University of Texas Medical Branch. Dr. Sharma, I'll hand it off to you to start the presentation.
All right, so just let me know, Jonathan, if you're able to see everything.
Yep, I could see it. You're good to go.
All right, so good afternoon, everyone. Like Jonathan said, my name is Mohit Sharma, one of the cardiologists at Mather Medical Group and Northwell Health. So today's topic, we're going to talk about women's heart health. I mean, the reason this is very important, you will see, down further in the slides why we consider heart disease one of the most important thing, because it kind of affects it is the number one kind of killer in both men and women, and that's why it's kind of important to be aware of this. So during the presentation, we'll talk about the prevalence of the heart disease in women. We'll go over some facts regarding the heart disease, and we'll go over the definition, what exactly is heart disease. And then we'll go over the risk factors that are associated with the heart disease. Some risk factors are considered to be a little bit more highly in the list compared to the other ones. And then we'll touch on the early detection of heart disease. And then at the end, we'll talk about some of the preventative strategies, how you can decrease your risk of heart disease. So let's talk about the prevalence of heart disease. It is still considered the number one killer in American women, no matter what their race or ethnicity is. If you really look at the data, it's kind of 1 in every 3 women in US who actually die from heart disease. Once you have a heart disease, it can damage your heart permanently, and it can affect, your other organs as well. So that's why it becomes very important to kind of realize and be aware of your heart health early on in life. If you looked at all the studies and look at all the data, there are more women who die from heart disease than from all forms of cancers combined. Even though, we consider breast cancer to be one of the highly on the list, or one of the biggest risk factors for a death for women, but, cardiovascular disease is actually kills a lot more women than breast cancer. If you just want to look at the numbers to put things in perspective, about 40,000 women from breast cancer versus 300,000 women from cardiovascular disease in a year. And this is just the data in the US. Every minute you can, based on these numbers, can consider that a woman dies from heart disease in the US. And interestingly, if you look at it, there are about 64% of women who die suddenly from heart disease who previously had no symptoms at all. And there's only half, about 45% of the women who recognize that who are actually educated enough or recognize that the heart disease is the #1 killer in the US. So again, not just a man's disease. Each year, about 1 in 3 women who die from either heart disease or stroke. I put stroke in there as well because stroke is also considered a cardiovascular disease. If you look at the numbers, estimated about 43 million women in the US are affected by cardiovascular disease. And since 1984, we had more women than men who had died each year from heart disease and stroke. And we'll go over the few trends of how they have changed within past few decades. So this slide, I put it in there kind of looking at the demographics. If you look at 2016, we had about almost 50% of the, about 15% of the population who was 65 or older. And now if you're looking at the projections, by 2060, we're going to have about 23% of the population who's going to be 65 years and older. The reason I put it in there because elderly age is actually considered one of the biggest risk factors for cardiovascular disease as well. Now, looking at the prevalence of cardiovascular disease or heart disease, this is just to put things in perspective. If you look at the risk with just one of the risk factors, which is hypertension, and this is all across, regardless of whether you're in your 20s and 30s versus if you're in 60s and 70s, if you had even one risk factors for heart disease, which is high blood pressure or hypertension, you can see your risk of heart disease goes significantly high compared if you did not have that. This graph is kind of showing you starting from 1980s, the cardiovascular mortality or death from heart disease in both men and women starting from 1980s. You can see that, since 2000, we had a significant decline in the cardiovascular death in both male and females. And that because there was a lot more awareness going on during that time. And this is people becoming aware of their heart disease, becoming aware of their risk factors for heart disease. And which is why down the line, if you see within about a decade, you had a significant drop in the numbers. But now for some reason, since 2010, we are seeing that there's increase in the cardiovascular mortality or death from heart disease, still kind of trying to figure out what's the reason that's causing this. So we talked about the numbers before. It's around like more than 500,000 deaths annually, combined both men and women when it comes to heart disease. So a few of the facts, that women are roughly 10 years older than men when they get either diagnosed or when they present with the symptoms of heart disease. And younger women have a little bit worse prognosis than younger men if they are diagnosed with a heart disease early on. And women are more likely to wait prior to seeking medical attention. This was the data prior to 2000s. And then the reason why you had seen in that graph that there was a decline in the overall mortality, that was because of the awareness and being a little bit more vigilant about your health and more education in the society. So for whatever reason, the data shows that women are referred less often for appropriate testing or treatment when compared to men when they present with the similar symptoms. So the prevalence of heart disease in general is higher in men than women when you're looking at the age group of less than 50. But it becomes similar in the 6th decade. And then after that, it's actually higher in women than men. And then there's another thing about hormone replacement therapy. It really does not reduce the incidence of heart disease or the stroke. In fact, if you look at some of the data from Women's Health Initiative, it actually showed that the hormone replacement therapy increases the risk of both heart disease and breast cancer. So what's the reason that you see that women are at higher risk of heart disease in their sixth and seventh decade of life? A little bit of this has to do with the hormonal changes after menopause. So this is very well known phenomenon that in the 2 years period before the onset of menopause, you see changes in the entire lipid profile. So your total cholesterol levels, they exceed above 200 in women. And approximately 35% of women have LDL cholesterol, which is more than 130. Normally, we like to keep it less than 130 or even less than 90, depending on certain risk factors. And you can see that after menopause, the total cholesterol and the LDL-C, which is considered the cholesterol or bad cholesterol, it increases by a mean of 10%. Before the age of 45, hypertension is more prevalent in men, and it becomes similar between 45 and 65, and it becomes higher in women than men. This is also has to do with the hormonal changes in the body. So some of the other risk factors for heart disease, which is another name we use, is atherosclerotic disease, which is basically a plaque buildup in the arteries. So CDC estimates that about 11% of women more than 20 years of age have diabetes, whether they're diagnosed or not diagnosed. And gestational diabetes, which later on becomes a big risk factor for diabetes following the delivery, it increases with age usually. If you look at the numbers, nearly 4 per 100 hospital deliveries in women more than 40 years of age at the risk of developing diabetes. And women with diabetes have a 3-fold higher risk of heart disease and a 5-fold higher risk of developing heart failure compared with women who do not have diabetes. And in terms of when you look at the data, looking at smoking, women have 25% higher risk of developing heart disease than men with the comparable number of smoking years. So what is heart disease? What is the basic pathophysiology? What happens that causes the reason why you get heart disease? So the bottom line is that your heart does not get enough blood supply to the heart muscle through the arteries. And it's not something that happens acutely. It usually happens through multiple decades, 3-4 decades of your life. And the term we talked about, atherosclerosis, which is buildup of plaque in the arteries, it's your bad cholesterol that gets deposited into the artery walls, and your artery stiffens over time. And it's the cholesterol itself, it's the fat in there, and then they build up and they basically compromising the blood supply when you talk about the heart to the heart muscle, but it also happens other areas of the body, such as the brain. This is one of the reasons people have a stroke as well. So, and once you have blockage, which becomes significant enough, that can result in a heart attack. So this is just a model looking at it. A lot of people think that the heart disease or the plaques, they start building up in your later half of life, starting from 40s and 50s. But in reality, if you really look at it, and this has been shown through studies in the past, that you start building up plaque or cholesterol plaques in the arteries starting from first decade of your life. And this is why your lifestyle modification and the importance of reducing the risk factors is very, very, very important. So some of your risk generally increases during the age of 40 to 60. The reason being, now, if you look at this slide here, if you had started building up the plaque from the early on in your life, from the first or second decade, By the time if you not taking care of things, get to your fourth or fifth decade of life, you have developed a significant amount of plaque, which is now putting you at a risk of having a heart attack. So some of the other risk factors, smoking is a big one, high blood pressure, high blood cholesterol, overweight and obesity. And this is very interesting as well because we have seen now in past 2 3 decades our rate of obesity has been dramatically increasing, even in younger population. Physical inactivity, diabetes, and this is very important, the family history of early heart disease. If somebody has a family history of somebody having a heart attack in their 40s and 50s, they're at a very high risk compared to the general population to have a heart disease. This is just in conjunction with the heart disease, with the having a heart attack. Women are they're more prone to get heart failure after they have a heart attack. And usually high blood pressure, which is hypertension, and atrial fibrillation, which is irregular arrhythmia, is very frequently present in women with heart failure. Stroke is another a disease process which is also goes along with the cardiovascular disease, because this also happens due to the plaque buildup in the arteries. And this is actually a fifth leading cause of death in women after your heart disease, cancer, and respiratory diseases. And the other risk is in younger women, the oral contraceptive use, pregnancy, preeclampsia, gestational diabetes, and smoking. All these things are considered a risk for heart disease. The good thing is you really have to know what are the things that you can do to reduce your risk of heart disease, because you can almost reduce your risk of heart disease by 80%. And the way you do that is through education, you do it by lifestyle modification, you do it by being aware of things, being aware of the risk factors and managing them appropriately. So one will talk about symptoms of heart disease. There are some symptoms that are considered typical and some symptoms which are considered atypical. So typical symptoms for heart disease are considered chest pain, discomfort in the chest, tightness in the middle of the chest, which lingers. It usually doesn't go away within seconds. It lingers from minutes to hours. And then few of the other symptoms that you can get is radiation of that pain to your jaw, to your neck, to your shoulders, even to your back. And people can present with the symptoms of getting out of breath, having nausea, vomiting, or lightheadedness. And some atypical symptoms, like I said, atypical symptoms would be having a chest pain that just comes on for a few seconds and then it goes away, has really no association with exertion, unusual fatigue, unusual shortness of breath, dizziness, flu-like symptoms. Even though these are atypical symptoms, it doesn't mean that they cannot be coming from heart disease. Some of the warning signs, I'll talk about this later, and especially in a woman, are shortness of breath. If you have new symptoms of getting out of breath easily, for example, if you were able to, do 3 loads of laundry, going up and down the stairs a few months prior, and now all of a sudden you feel like you're not able to, or you get out of breath easily, that's a warning sign, or that's a concerning sign. It doesn't mean that you might be having a heart attack, but that's something you should not ignore and should actually go and get it checked out about. Few other symptoms are breaking out in cold sweat, having nausea or lightheadedness. So chest, typical symptoms we talked about, it's usually in the center of the chest. lasting for a few minutes to hours. It can go away and then come back again, usually with exertion. And you can have pain in the other areas of the body as well, such as upper body, jaw pain, pain going down your arms, pain in your back, or pain in your stomach. Now we were talking about the risk factors, smoking, hypertension, diabetes. So diabetes alone, it actually doubles your risk of fatal heart disease, because diabetes is known to clog up your arteries at a very, very, very fast rate. Smoking is associated with almost 50% of all the heart disease. When we talk about coronary events, we're talking about having a heart attack. 50%. And the risk is elevated even with the minimal use of smoking. So even having, using 1 to 2 cigarettes a day still puts you at a higher risk of having a heart disease or having a heart attack compared with somebody who does not smoke. Again, these are some of the symptoms. Like I said, they do not have to be typical. Some symptoms you can feel like having pressure or elephants sitting in the middle of your chest. You can have symptoms where you have back pain or neck pain, jaw pain. You can have symptoms of getting out of breath, almost feeling like asthma symptoms, breaking in cold sweats, having fatigue, which is not going away, having symptoms of dizziness or lightheadedness, or even having symptoms of nausea and vomiting without any other illness. The reason why the symptoms, the dyspnea means getting out of breath with your normal activities. Why it's most important, because in the studies we have seen that women generally do not present with the typical symptoms of having chest pressure or chest pain. They more commonly present with symptoms of getting out of breath, not being able to catch their breath when they actually try to exert themselves. They also present with symptoms of weakness, fatigue, sleep disturbances. So these are the symptoms that are more generally present in women compared to men. So if you look at the registry of a million people, including men and women, who presented with the heart attack, 42% of women presented without chest pain versus 31% of men. And women, for some reason, have a higher in-hospital mortality compared to men. And younger women are usually considered, without chest pain, considered to be a higher risk. So what can you do about heart disease? It's everywhere. There are a lot of things that you can do in terms of changing your lifestyle, being more active. So the only way you can make these changes if you're aware of these things. So there is something called the multiplier effect. If you have one of the risk factors for heart disease, such as high blood pressure or diabetes, only one risk, it doubles your risk for heart disease. If you have two of those things, if you have hypertension and diabetes, it quadruples your risk when compared to normal population. 3 or more risk factors can increase your risk more than tenfold. So few things you can do to prevent the heart disease that will actually, if you just take only simple measures in life, it can decrease your risk of heart disease by 80%. What are those things? Eating right, being aware of the calories you're taking in, being aware of the food you're eating, being physically active. So we have known that now we know that even half an hour of activity a day is actually can reduce your not only risk of heart attack or stroke, even dementia by a lot. quit smoking, keeping a healthy weight. If you do just these 4 things, eating right, physically active, not smoking, keeping a healthy weight, you can decrease your risk of heart disease almost by 80%. Maintain a healthy weight balance, calories taken in with those used up in physical activity. Keep a track of things, how much you're eating, how much activity you're going to be doing throughout the day. Once again, stop smoking. Manage your diabetes. There are a lot of medications out there. There are a lot of things you can do to control your diabetes. Along with medication, going for a regular exercise is really helpful in terms of managing your diabetes and controlling the risks that are associated with it. And take your medications if you're prescribed a medication for diabetes, for high blood pressure, for high cholesterol. And this is something that you cannot wait on. You have to start taking initiative today. The longer you wait, the more or the higher the risk you're exposing yourself to. So be physically active. How much exercise? People always talk about it. 30 minutes of moderate intensity activity on most days of the week, at least 5 days. You follow a healthy eating plan. These days, there are a lot of resources available online. You can just sitting at home. It's always a good idea to get an expert advice, but even sitting at home, you can always look up things, healthy diets, low saturated fat, trans fat, and cholesterol, and moderate and total fat. Limit your salt and sodium intake. And if you do drink alcohol, try to minimize it to not to have more than 1 drink a day. Again, what is the recommendation for exercise? 30 minutes a day. So if you do that for 5 days, that's about 150 minutes a week of moderate exercise. Or if you do high intensity workout or exercise, that's 75 minutes a week. So how, other than changing your lifestyle and making those changes on your own, what are the other things you can do? So you have to be more vigilant. You have to take initiative. You have to go to regular checkups to make sure that your blood pressure is well controlled, to make sure your blood cholesterol is well controlled. You got to check your blood glucose levels to make sure that you're not at a risk of developing diabetes or not already have diabetes. Be aware of your weight, your body mass index. Get an EKG. Who needs a stress test or not? That could be, determined by your physician, whether you're somebody who will require a stress test or not. And vascular screening. That's looking for, for somebody who's at a high risk of having a stroke. So this is very interesting. This shows that some of the technical difficulties, if you compare men versus women having a procedure, any kind of cardiac procedure, we're talking about this one having a cardiac catheterization, which is angioplasty or a stent placement after having a heart attack. For whatever reason, the women are at a higher risk of complications during the procedure. And those complications include having damage to the artery where they go in to do the procedure. One of the reasons that you see why they have that is because the size of the arteries is relatively smaller compared to men. They're at a high risk of having complications after putting a stent in. They're at a high risk of having a heart failure after having a heart attack. They're at a high risk of having kidney issues after the procedure secondary to the contrast. So these are a little bit of the things to kind of be aware of. The reason I showed the slide before that was going over the demographics that we're looking at projections in 2060, that we're going to have more people over the age of 65 by 2060 is because The reason I showed it because advancing age is the most powerful independent risk factor for heart disease. Because there are a lot of things that go into this. You have to be very careful. One thing is the hormonal changes. Second thing is their coexisting conditions. Third thing is the number of medications that they're on. And the other thing you cannot forget about is they're being very frail as we get older. So these are the things that actually put you at a risk, higher risk of having a heart disease. So some of the numbers, roughly to remember or to be aware of, that your blood pressure should be around 120, the top number, which is systolic blood pressure, over 80, which is the diastolic blood pressure. Looking at your cholesterol numbers, so roughly your bad cholesterol, which is LDL, it should be less than 100. Your body mass index should not be more than 25. Your waist size should not be more than 35. These are the certain risk factors that you have the ability to change by diet and lifestyle modifications. And if you do have diabetes, you should be aware of the numbers that your hemoglobin A1C should be less than 7%. These were the guidelines. There are a lot of people who come into the office. We always have conversation about that. You always hear this, that based on my age, what should be my blood pressure goal? So we used to have guidelines that were based on your age. If you are in your fifth and sixth decade of life, your blood pressure target should be different than in somebody who's in their 20s and 30s. But most recent data and the guidelines are that regardless of your age, we should have a better control of your blood pressure. So like I said, the number to remember is 120 over 80. This is by the guidelines. It's saying that your blood pressure should not be more than 130 over 80, regardless of what your age is. So what to do if you know somebody or if you've already been diagnosed with the heart disease? In past few decades, we have made a lot of improvements in terms of managing people with heart disease. So it's never too late. If you are somebody who has not been eating well and now you have all the risk factors for heart disease or been diagnosed with the heart disease, you can still try to make the changes today, which will still have effect down the line. And how do you do that? Eat healthy, exercise regularly, watch your weight, quit smoking immediately, keep your weight under control. These are some of the things that help along with taking your medications every day. So make an appointment with your doctor. Get a routine workup, including your blood work, get an EKG, your blood pressure check, and further cardiac testing, depending on if you have high risk of developing the disease or not. And that should be determined by your doctor. So get your numbers, own your lifestyle, raise your voice, educate yourself and your family, and show support in the society. And I think that concludes the presentation. And
Awesome. Thank you
we'll
so
go over the
much.
questions. Yeah.
Yeah, thank you so much, Dr. Sharma. If anybody has any questions, you can enter them in the Q&A feature at the bottom of your screen. All questions are anonymous to protect your privacy. I think we already have one. Dr. Sharma, are you able to see?
Is it in the chat or?
Yeah, there's a Q&A feature on your screen. There might be a red one near it. If not, I can read these questions out to you.
Let me see. 67, 50 pounds inducement. Okay, so about taking the medication for weight loss, This is a good thing. Reducing 50 pounds of weight is a significant amount of weight, and you already have made progress in terms of lowering your risk. And the key is now, even though, these medications, technically you're supposed to, the key is that you take them. People always ask about how long do I have to stay on the medication? Pretty much lifelong. So the second thing now with that, if for whatever reason you're not able to, consider that as a stepping stone, that you have already made that progress. So one of the ways these medications work is that they reduce your appetite. So they get you into that habit of changing the way you eat. So if you cannot stay on the medication for whatever reason, if you continue to stay with that lifestyle, you will see that you will still continue to lose weight and you will continue to reduce your risk of heart disease. Do we have local practice to refer for in terms of cardiology? Yes, we have a Mather Medical Group Cardiology under Northwell. We have few offices. One is in Port Jeff, one is in East Setauket, one is in Rocky Point. Another question about, are PVCs dangerous? So PVCs can be a marker or can be a sign of a heart disease. Not necessarily all PVCs, but if somebody does have, you'd see a lot of younger population in their 30s and 40s having PVCs. Nobody really knows why they have those PVCs, but PVCs can be secondary to blockages in the arteries. And one of the workup we do for people with PVCs, send them to some sort of cardiac testing, such as stress test or something, to make sure that they're okay. Anybody else?
Looks like you have a few more questions here, Dr.
Let me see.
Looks like the next one is, what if you have an AFib?
If you have AFib, is risk higher? AFib is a risk factor for heart failure, and you can reduce your AFib burden. One thing is, by if you are on medication, you can reduce it by that. Exercise reduces your risk of AFib. Overweight is one of the biggest risk factor for AFib. If you reduce your weight, you can reduce the burden of AFib. Also, one of the least talked about things is sleep apnea. If you have sleep apnea, until you control your sleep apnea, you will not be able to manage your AFib or reduce the risk of AFib. So those are the few things that you could do. So people who have tachycardia. So tachycardia, there are different kinds of tachycardias. Some people can have tachycardia, such as AFib, and other people can have more malignant tachycardias, and you manage them, and they do reduce your risk of heart disease. But if they're managed appropriately, there are few tachycardias that you can do a procedure for to get rid of them, and it has very good outcome. But if tachycardia is not managed well over the years, they can put you at a risk of heart failure. Thyroid levels are not to be controlled. So thyroid hormone is one of the hormones that's involved in controlling your blood pressure and heart rate. So if your thyroid levels do fluctuate, you do need to seek endocrinology consult to make sure that your levels are constant or they're stable, because it wouldn't make sense to control your tachycardia or blood pressure if you're having fluctuations in your thyroid hormone levels. So it would be, it's important to manage that. And sometimes when you do that, your blood pressure and heart rate gets controlled on its own. PVCs are something called premature ventricular contractions. These are sometimes picked up on the EKG. When you have a normal EKG, routine EKG in the office, you can have one or more than one abnormal beats, which will be picked up on the EKG. Or sometimes people feel the symptoms of some of the things people, the way they describe them is having um, a very strong heartbeat, or people having symptoms of chest discomfort with the beating of their heart. So those are the things that you can see with the PVCs. Thyroid, we talked about. So thyroid, depending on if your thyroid levels of the hormone levels are high, that causes increase of heart rate or tachycardia, and also cause hypertension, high blood pressure. And if you have low thyroid hormone, that usually causes low blood pressure. So SVT, there is no significant data showing that it's a big risk factor for heart disease. SVTs are more common than we think of them. They're a lot more underdiagnosed. This is what I was talking about. If you have a history of SVT, and some of the things that cause SVT or that can actually precipitate SVTs are smoking, high caffeine intake, any kind of stimulant. So if you are on medication for SVT, and if you had a procedure done to get rid of the SVTs, that reduces your risk, or it does not increase your risk at all. What can cause PVCs? There are a lot of things that can cause PVCs. One of them being, like I said before, you want to make sure that there is no blockages in the arteries of the heart, because compromise of blood supply to the heart muscle can cause you to have PVCs. Other things that can cause PVCs is sleep apnea. If you are overweight, if certain medications can cause PVCs, medications people take for anxiety and depression, some of those medications are known to cause PVCs.
All right, that looks like it was the last question. So I would like to thank you, Dr. Sharma, for that amazing presentation.
All right.
I'd like to thank everybody for joining. If you have any other questions, you can email them off to matherhospital@northwell.edu. And if you'd like to view past HealthyU webinars, you can view them at www.matherhospital.org/HealthyU. So thank you all so much. Thank you again, Dr. Sharma, and I hope
All right.
everybody has a
Thank you,
great day.
everyone. You guys have a nice day.